It's award time.
It is award time, and it's always the most fun part of the day. And now we're on this is our third award for the day that we're giving. And the next award up is the Trailblazer Award. And the Trailblazer Award recognizes an individual who creatively opens new pathways for people to be supported in their recovery, an individual who thinks outside the box, who charts a course that inspires others to follow.
We couldn't be more excited about this recipient, who is really a national treasure for the work they're doing in our state.
Hello, Dr. Warne. Thank you for joining us.
Very happy to be here.
So you may be wondering why we've got the Recovery Reinvented backdrop behind us. Well, we have a special surprise for you.
Dr. Warne, you've got an incredible career, and we're so grateful that you're serving North Dakota in so many ways. But for all the amazing work you've done, including most recently establishing the world's first Indigenous Health Ph.D. program, on top of everything you've done with the Indian Medicine program at the University of North Dakota Medical School, but for advocating for the health and recovery of all Native Americans, and for being a thought leader in blending modern medicine with traditional healing, we are honored, the First Lady and I, to present you with the 2020 Recovery Reinvented Trailblazer Award, recognizing you as one of North Dakota's best recovery champions.
Yay!
Wow, what an incredible honor, and what a incredible surprise. I had no idea that was going to happen. Just unusually at a loss for words. But also just please do recognize how much I admire the work that both of you do for the benefit of people in our state and people who are at risk, and certainly the populations that are going through addiction and recovery and trying to improve their lives and outcomes. This work wouldn't move forward without leadership from the very top. So I'm deeply honored with this award, and very surprised as well. But please know that all this work is a team effort, and certainly I really value your collaboration and your leadership on all of these efforts. So thank you so much.
Well, thank you for being such a great leader, and we're, as I said, so grateful to have you in the state. And we're excited that we're actually able to surprise you. You know, this day and age, you can't keep things a secret sometimes, but we're happy about that. But is there anything you'd like to maybe share or expand with the Recovery Reinvented audience? We've got a couple thousand people watching online, and I'd love to hear more about the work that you're doing, and particularly how it relates to the challenges of recovery and addiction and the disease of addiction during this time where there's, by necessity, sometimes more isolation and separation.
Yeah, certainly right now, it's very challenging for all populations, just looking at the whole idea of social distancing and the dangers of being socially isolated for health in general. And I think with you throw on top of that populations that are dealing with behavioral health challenges and addiction and going through the recovery process, the whole idea of social distancing is not good in those circumstances. And I wish we'd use the term physical distancing and not social distancing, because in truth, we need to be socially connected with one another now more than ever. So even if we have to do things more virtually or having 6 feet apart and wearing masks, having that social connectedness is so vitally important. So right now during the pandemic, there's so many things that we can't do in terms of being connected to each other, but there's still a lot of work that needs to be done to ensure that people who are vulnerable or maybe feeling isolated do have that sense of connection. We are deeply concerned about some of the mental health outcomes of the pandemic. So clearly the work related to Recovery Reinvented and all of us who are working in health in general, public health and mental health, we need to make sure that all of our community members feel valued and are genuinely connected with each other.
Yeah, absolutely. It's so important during this time. And you know, again, you know, the work you do to help identify and educate about the disparities is so important. In my work on the board of Hazelden Betty Ford, you know, I am a champion for how can we get better services opportunity, more opportunities for treatment for the Native American community. And you know, I'm grateful for the work that you do, because the communications and education around that really helps people understand these very significant disparities in how Native Americans are the most adversely affected population related to the disease of addiction across our nation.
Yeah, absolutely. And that's one of the reasons why we need to build a bigger, more well-educated workforce. And certainly we need to create opportunities for our own community members to pursue higher education and to go into health sciences. And just very briefly, we're so proud of what's going on at University of North Dakota. As you had mentioned, our first cohort of students in the PhD in Indigenous Health started this summer. And very happy to announce that we have 19 students in the first cohort of the PhD program. Of the 19, 17 are American Indian. And then combining that with our 8 first-year in-med medical students, we have 25 first-year doctoral students who are American Indian right here at University of North Dakota.
Yay, fantastic. Awesome. Fantastic.
Well, incredible work you're doing. And again, so honored that you could join us virtually today. Thank you for thanks for dialing in. Thank you for letting us surprise you, and of course a super well-deserved honor because all of North Dakota is grateful for the work that you're doing, and so grateful that you're able to join us today.
Yes.
Thank you again. Really appreciate it. What an incredible honor. Thank you.
Thank you. Be well and stay safe. Take care.